Hello and welcome to today's Talk of the Town. I'm Sandy Benson. We have a great show ahead for you, so sit back, relax, and enjoy. Hilton Head Hospital Breast Health Center is the only dedicated breast health center of its kind in Beaufort and Jasper County. Their hallmark commitments of experience, compassion, and dedication are exemplified in the services they provide and the professional and specialized staff they offer, of which two members, Dr. Jennifer Cranny and Ranie Howe, join us today. Welcome to the show.
Thank you. Thanks for having us.
Ranie, I'm going to let you start a little bit by telling us, just give us a little bit of information about Hilton Head Hospital's Breast Health Center.
Well, at Hilton Head Hospital, we have a full-service radiology department. We can take care of most of your imaging needs, and part of that is a breast imaging center. The breast imaging has really grown, and so we've decided to take it to the next level with accreditation.
So you now have the Breast Imaging Center of Excellence accreditation. Correct. And so how did you achieve that?
Well, the Breast Imaging Center of Accreditation is a voluntary accreditation offered through the ACR, the American College of Radiology. In addition to our mandatory mammography accreditation, we had a rigorous accreditation program or modules that we had to attain in stereotactic breast biopsy, ultrasound-guided breast biopsy, and ultrasound breast exams. In January of this year, we received accreditation in stereotactic breast biopsy, and with that, we're designated a Breast Imaging Center of Excellence. We are now one of 9 facilities in the state of South Carolina.
Wow.
So Hilton Head Hospital has achieved that special recognition.
Yeah, that's
of course under the leadership of Dr. Jennifer Cranny.
That's superb, and it's got to show well for the hospital as well as your department, the radiology department.
The staff, the employees were all very excited about the achievement because part of that is special training and education, not only for the physicians but all the technologists that work there too.
Right. What are the benefits of that accreditation, not only to the hospital but say to your patients?
Well, it sort of gives us that gold star or that 5-star rating for our facility. Again, with the enhanced training of the physicians and the technologists, it really ensures the proficiency of our staff. The community can feel confident in their ability. The other thing it does demonstrate is our commitment to perform at a high level, and Hilton Head Hospital's commitment to fighting breast disease.
Right. Right. So some of the services you provide?
Well, we provide the stereotactic, ultrasound-guided, and MRI-guided breast biopsy. Even though MRI-guided biopsy is not part of the module requirements for the Center of Excellence, Dr. Cranny has introduced that service to the hospital. We have, again, the ultrasound breast, the mammography. We have state-of-the-art technology. It's digital mammography. We have the mammo pads, which offers great comfort to the women that use our services. And we have, the CAD stream. I can't remember what that was. So we also offer then the CT, normal X-ray, nuclear med exams.
Yeah, quite an array of testing.
It's a full-service radiology.
Full-service radiology. Yeah, it's amazing. Dr. Cranny, let me ask you, what are the current recommendations of screening mammograms right now?
Right. I wanted to have this addressed because there has been so much controversy in the literature about
absolutely.
this and on the news. We still, in the American College of Radiology and in the Society of Breast Imaging, encourage yearly screening from age 40 on. That is for normal risk patients. We do say that if a patient is a high-risk patient, they should talk to their doctor about getting screening earlier. If a patient has any palpable abnormality, any clinical abnormality, they should get a mammogram and an ultrasound no matter what age that. If they're less than 30, we do an ultrasound. If they're 30 to 40, we do both mammogram and ultrasound for clinical abnormality.
How does somebody know if they're at risk? What are some of the...
Family history is the biggest risk factor. Not having a baby, dense breast tissue, A lot of times patients should talk to their doctors about their risk factors.
Sure. And so what are other ways that women can stay proactive in their breast health?
In addition to the mammograms, women should always do clinical breast exams on their own. And it's good to do it at the same time every month, so you kind of time it with your cycle and you know what your breast feels like at that time of the month. You should always have a doctor that you have checking you out and continue to have a clinical breast exam from the doctor as well.
Right. So if someone just has questions or concerns and they're, I guess, maybe not a little apprehensive about actually coming in, can they just call the facility and speak to someone who may put them at ease, and then hopefully get them in if it's necessary?
Absolutely. They can give us a call. I don't know if you'll put the hospital's number up, 681-6122.
Yes.
And we'd be more than happy to answer their questions that they may have about the exam itself, scheduling availability.
Yeah. And so if somebody needs to be seen, is that a recommendation you can make, or does it have to go through a regular physician, or how does that progress?
That's generally from their physician. If they have a clinical problem especially, they generally see their physician, who then order the test. And we are really good about getting patients in the same day or within a couple days.
Right. Right. Well, it's such an important topic anymore, you know, so we appreciate the services Hilton Head Hospital has accomplished and your accreditation. Congratulations.
Thank you very much.
And thank you so much for joining us today.
Thank you.
And we will be right back with Talk of the Town.